All right, let's dive in. We're going to tackle something that can feel super complicated, medical billing. And specifically, we're zeroing in on the codes that are at the heart of all asthma treatment.
So, have you ever looked at a medical bill and felt like you were trying to read a secret code? You are definitely not alone. Today, we're going to translate that language and figure out exactly how a simple checkup for asthma turns into that long, confusing list of charges.
The entire system is built on something called CPT codes. Now, CPT stands for Current Procedural Terminology, but you can just think of it as the universal language for healthcare. Every single thing a doctor does, from just talking with you to doing a complex test, gets its own special 5-digit code. This is what ensures a clinic in California and a hospital in New York are, speaking the same financial language. Here's how we're going to break it all down. We'll follow a patient's journey, starting with that first diagnosis, then moving into the day-to-day care, and we'll even see how things change when flare-ups happen. We'll also touch on some of the newer, more advanced treatments. And then we'll wrap it all up by talking about why getting these codes right is so important for everyone involved. Okay, so let's start right at the beginning. A patient walks into the doctor's office, they're having some trouble breathing, and the doctor thinks, this might be asthma. This is the moment the coding journey really kicks off. The whole diagnostic process follows a pretty clear path. First, the doctor listens to what's been going on and does a physical exam. Then come the tests to see what's really happening inside the lungs. And finally, they take all that information and build a treatment plan. And yep, you guessed it, every single one of those steps generates its own specific code. The bedrock of any doctor's visit are these things called evaluation and management codes, or E&M for short. Now, these aren't for procedures like a test. They're for the doctor's brain power, the time they spend with you, how complex your problem is, and how tough the medical decisions are that they have to make. A really crucial difference in billing is whether you're a brand new patient or someone they've seen before. That first ever visit for asthma might get coded as a 99203, which reflects a pretty deep dive into your health history. But follow-up visits, they use a completely different set of codes, like a 99213, because the doctor is building on a relationship they already have with you. And that distinction makes a big difference in how the visit gets billed. All right, so next, the doctor needs some real data. Spirometry is kind of the go-to test for measuring basic lung function, but they might also do a bronchodilation test to see if a rescue inhaler actually helps you breathe better. And because asthma is often linked to allergies, a skin test can help identify those triggers. There's even a newer test called a phenotest that can literally measure the inflammation in your airways. Each of these tests is a different piece of the diagnostic puzzle, and each one gets its own code. So once asthma is officially diagnosed, the whole goal shifts. It's not about discovery anymore, it's about management. This is a chronic condition, so the billing starts to reflect that routine, ongoing care needed to keep symptoms under control. This is where those establish a patient codes we talked about really come into play. A standard checkup for someone whose asthma is pretty stable would probably be coded as a 99213. If there's a small flare-up or the doctor needs to tweak some medications, the complexity goes up a bit, and that visit might get billed as a 99214. A huge part of managing asthma isn't just about medicine, it's about education. Teaching someone how to properly use their inhaler or how to avoid their triggers is absolutely critical. And what's really important to get is that this education is considered a formal medical service. It's billable. As you can see, there are specific codes for it, whether it's just one-on-one or in a small group setting. It just goes to show you that in modern healthcare, patient training is a key part of the treatment. But of course, things don't always go according to plan. An asthma attack, or what doctors call an exacerbation, is a medical crisis. And when that happens, the billing codes have to shift to reflect that urgency. During an asthma attack, you're probably not going to your regular doctor's office. You're heading to an urgent care center or the ER. And as the location of care changes, the coding changes right along with it. The codes now have to capture the intensity and the urgency of all those life-saving things that are happening. So, in the ER, the visit itself is coded on a scale of how severe it is, from 99281 all the way up to 99285. A really bad asthma attack could easily be a 99284 or a 99285. And then you have the treatments. A standard nebulizer treatment is code 94640. But if things are more serious and you need continuous inhalation, well, there are separate codes for that, depending on whether you're getting oxygen or not.
Now, asthma care isn't standing still. It's always evolving. We've got new biologic drugs, we've got digital health tools. They're all changing the game, and you better believe the coding system has to run to keep up. The codes are absolutely evolving with medicine. These advanced biologic therapies for severe asthma, they have their own administration codes. And check out telehealth. You use the same visit code, maybe a 99214, but you add a little tag on the end, a modifier -95, to show the visit happened remotely. We even have brand new codes for setting up and managing remote patient monitoring devices from afar. It's pretty cool. So, we've looked at all these different numbers and scenarios, but why is it so incredibly important to get them right? Well, it turns out accuracy here has a ripple effect across the entire healthcare system. And believe me, it is easy to make mistakes. Using an old code, forgetting one of those little modifiers, or just not having the right documentation to back up the service you billed for, any of those can get a claim denied. And it's not just about overcoding. As you see here, if you don't code for services that you actually provided, like that patient education, it means clinics aren't getting paid for the work they really did. If there is one golden rule in all of medical billing, this is it. The patient's chart, the doctor's notes, the test results, the whole treatment plan, that is the evidence. Every single code that gets submitted on a claim has to be backed up by clear, detailed documentation. Without that, the code is really just a meaningless number. This quote really just sums it all up perfectly. Successful coding comes down to 3 things: great documentation, knowing which codes to use and when, and constantly staying up to date with the latest rules. At the end of the day, this is about so much more than just money. When coding is done right, it creates this kind of awesome positive feedback loop. Providers get paid fairly, which lets them keep their doors open. That correct data then helps public health researchers improve treatments for everyone. And of course, better treatments lead directly to better care for patients. Which leaves us with a pretty fascinating question for the future, right? As our treatments get more and more personalized, and technology just keeps marching forward, how is this universal language of codes going to adapt? How it keeps pace is really going to define the future of how we value and pay for all of healthcare.